The African Task Force for Coronavirus Preparedness and Response is a continental approach that has been endorsed by the Ministers of Health of Africa when they met here on February 22nd and urged Africa CDC, WHO, and other partners to develop a continent-wide approach. The task force has 6 different technical working areas, including laboratory and subtyping, surveillance and enhanced port of entry screening, infection control and prevention, clinical management, commodities, and risk communication. That's how the continent has organized itself to be able to prepare to respond to the coronavirus epidemic. The working groups are co-led by member states, the Africa CDC, and the WHO. So the working groups decide or discuss priority areas to focus on. For example, the laboratory working group has organized trainings in Dakar, South Africa, and other places to very quickly ramp up diagnostics. From just 2 countries, South Africa and Senegal, that were able to conduct appropriate testing in the beginning of February to now 43 countries in just 4 weeks. That's a good example of what that technical working group can do. Other working groups have actually contributed as well, like the technical working group on infection control and prevention have organized a competency-based training of trainers in Nigeria. The risk and communication working groups have organized a similar working group activities in Tunisia. The care and treatment group have trained now more than 1,200 community of practice by a network approach. So that's how the working groups are actually supporting the continent to prepare member states for the imminent spread of the coronavirus. What we need to go forward is to increase our ability to cascade the trainings that have been developed into each member state at various levels, that is at both the national and subnational level. We also need to expand the testing. Our strategy for Africa is still built around early detection and containment. Then we should expand testing as much as possible so that we identify cases early on and isolate them and make sure that we help to provide the appropriate care that is required to manage these cases.